Ladies and gentlemen, I'm grateful for the opportunity to address you today in my capacity of Director of the Division for Social Policy and Development of the United Nations at the United Nations Department for Economic and Social Affairs in New York. From the beginning, the United Nations has been working to ensure equality and inclusion of persons in their societies, including persons with disabilities. The normative framework that guides our work comprises many policy instruments, including the World Programme of Action concerning persons with a disability, which was adopted in 1982, as well as the Standard Rules on the Equalization of Opportunities for Persons with Disabilities from 1993, and the United Nations Convention on the Rights of Persons with Disabilities. As we know, adopted by the General Assembly in 2006, the Convention has stood out as a useful tool for building the needs of persons with disabilities into laws and policies at national level, and it has also served to elevate the norm from a situation of viewing persons with disabilities as objects of charity, medical treatment and social protection towards viewing persons with disabilities as subjects with rights, who are capable of claiming those rights and making decisions for their lives based on their free and informed consent, as well as being active members of the society. So our discussion here today and the promotion of the World Health Organization Disability Action Plan can only help to further strengthen this disability-inclusive approach to national and international development. The MDGs, Millennium Development Goals, have seen many successes in the global health space and have shown the value of a clear, collective vision combined with focused targets for measuring progress. In the final accounting, we have made enormous progress. The MDGs for safe drinking water and reducing malaria, tuberculosis, and HIV are expected to be met. Although attaining the target for lowering child mortality will be difficult, child deaths have dropped dramatically. Coherent national policies aligned to global agreements have resulted in progress across the health of the MDGs. So, we have to say that, however significant progress has been achieved, gaps remain, including in maternal mortality, child malnutrition, access to reproductive health, and affordable essential medicines. In other cases, the measurement of averages has marked multiple and intersecting problems, such as discrimination against persons with disabilities. Persons with disabilities encounter a range of barriers to health care, from affordability of health services and transportation to lack of appropriate services for persons with disabilities and inaccessible healthcare facilities. These barriers lead to unequal access to healthcare services, and in many cases, they lead to unmet healthcare needs compared with the general population, and poorer health is there. So disability has been left behind in the MDGs and needs to be included within the health goal of the SDGs, the Sustainable Development Goals. The SDGs are ambitious and go beyond the MDGs by addressing inequality and inclusion in many targets. None of the SDGs health targets addresses persons with a disability specifically, but the current SDG proposal clearly asks for increasingly collected data, disaggregated data by disability. And this will be relevant for all the targets under the SDGs health goal. It is the only way to monitor and ensure that persons with disabilities have the same health access and outcomes as those without disabilities. The framework of the World Health Organization Disability Action Plan will be key for achieving the SDG health targets for persons with disabilities. With its focus on removing barriers, strengthening and improving access to health services and programs, strengthening rehabilitation, assistive technology, assistance and support services, and on community-based rehabilitation, well, the World Health Organization Disability Action Plan will complement the SDGs in providing the guidance needed to achieve the health targets. The SDG framework and the World Health Organization Disability Action Plan together have the potential to mobilize people and countries and to transform and create more inclusive society.